HIV stands for Human Immunodeficiency Virus. It's a term you may have heard before, but understanding what it means is the first step in taking control of your health. HIV is a virus that specifically targets the immune system, which is your body's natural defense against illness and infection. When HIV enters the body, it attacks important cells that help fight off germs and diseases, making it much harder for your body to stay healthy over time. The immune system is like a shield, protecting you from everyday viruses and bacteria. But when HIV weakens this shield, even common illnesses can become serious. That's why it's so important to know whether or not you have HIV, so you can take steps to protect your health and the health of those around you. An HIV test is a simple and confidential way to find out if you have the virus. These tests look for signs of HIV in your blood or saliva, and results can often be ready in just a few minutes. There are different types of tests available, including rapid tests that use a small drop of blood or a swab of saliva, making the process quick and easy. Knowing your HIV status is crucial for both your personal well-being and for preventing the spread of the virus to others. When you know your status, you can make informed choices about your health, relationships, and future. It also helps reduce the stigma around HIV, encouraging more people to get tested and talk openly about their health. Early detection of HIV allows individuals to access treatment sooner. Modern treatments, known as antiretroviral therapy, can help people with HIV live long, healthy lives. Starting treatment early not only improves your own health outcomes, but also greatly reduces the risk of passing the virus to others. With proper care and medication, people living with HIV can manage the virus and maintain a healthy, active lifestyle. Regular checkups and sticking to your treatment plan are key to staying well and enjoying life to the fullest. Knowing your status also empowers you to make informed decisions about your sexual health, protecting yourself and your partners. Open communication, regular testing, and safe practices are all part of taking responsibility for your health and the health of those you care about. Regular testing is especially important for people with certain risk factors, such as having unprotected sex, sharing needles, or having a partner whose HIV status is unknown. But even if you don't think you're at risk, getting tested is a smart choice for everyone. It's a simple step that can make a big difference in your life and in your community. In fact, health experts recommend that everyone get tested for HIV at least once as part of routine healthcare. For some, more frequent testing may be needed. Talk to your healthcare provider about what's right for you. Remember, early detection is key. Taking charge of your health by knowing your HIV status is a powerful act of self-care and compassion for others. Don't wait. Get tested, stay informed, and help build a healthier future for everyone. Have you ever felt like your mouth was suddenly transformed into a desert, leaving you desperate for a sip of water? That uncomfortable, parched sensation is what we call dry mouth, or in medical terms, xerostomia. It's a surprisingly common experience, and it can strike at any time, whether you're nervous, dehydrated, or even just waking up in the morning. Dry mouth happens when your salivary glands don't produce enough saliva, the watery, slightly slippery fluid that keeps your mouth moist, comfortable, and healthy. Saliva isn't just there to help you swallow. It also plays a crucial role in protecting your teeth, washing away food particles, and even helping you taste your food. When your mouth doesn't make enough saliva, you might notice it right away. You could feel a sticky, dry, or rough sensation on your tongue, gums, or the roof of your mouth. Swallowing can become uncomfortable, and you might find yourself reaching for water more often than usual. Dry mouth can show up in a variety of ways, and the symptoms can range from mildly annoying to downright disruptive. For some, it's just a nuisance, but for others, it can make everyday activities like eating, speaking, or even smiling feel like a challenge. You might notice your mouth feels sticky or that it's hard to speak clearly. Sometimes your throat can feel dry and scratchy, making it tough to get your words out or swallow food comfortably. Your mouth might even feel sore or tender, especially if you've been dealing with dryness for a while. This discomfort can sometimes lead to small cracks at the corners of your mouth or even mouth sores. Another common sign is a change in your sense of taste. Foods might taste different, less flavorful, or even metallic. This can make eating less enjoyable and might even affect your appetite. Some people also notice persistent bad breath, which can be embarrassing and affect your confidence in social situations. Saliva helps keep bacteria in check, so when it's lacking, odors can build up more easily. Chewing and swallowing dry foods like crackers or bread can become especially difficult. You might find yourself needing to take frequent sips of water just to get through a meal. While dry mouth is often temporary and harmless, may be caused by dehydration, stress, or certain medications, sometimes it can be a sign of an underlying health issue like diabetes or a problem with your salivary glands. If you find yourself constantly battling a dry, uncomfortable mouth, or if it's interfering with your daily life, it's a good idea to talk to your doctor or dentist. They can help you figure out what's causing it and suggest ways to get relief, so you can get back to feeling comfortable and confident. The thought of taking an HIV test can be nerve-wracking. For many people, just walking into a clinic or opening a test kit at home can bring a rush of emotions. There's often a mix of fear, uncertainty, and hope all at once. You might find your heart beating a little faster, your palms getting sweaty, or your mind racing with what-if scenarios. These feelings are completely normal, and you're definitely not alone in experiencing them. It's a normal human response to feel anxious, especially if you're worried about the potential outcome. The anticipation of waiting for results, or even just the act of getting tested, can make anyone feel uneasy. Sometimes the anxiety is about the unknown, or about what a positive or negative result could mean for your life, your relationships, and your future. This is a shared experience for countless people around the world, regardless of background or circumstance. This anxiety can manifest physically, and for some, dry mouth is a common symptom. You might notice your lips feeling parched, your tongue sticking to the roof of your mouth, or a sudden urge to drink water. These physical sensations are your body's way of responding to stress, and they can be surprising if you're not expecting them. When we're stressed or anxious, our bodies go into fight or flight mode. This is an ancient survival mechanism that prepares us to face danger or escape from it. Even though taking an HIV test isn't a physical threat, your body can still react as if it is, triggering a range of stress responses. This natural response triggers a cascade of physiological changes, including a decrease in saliva production. Your mouth may feel dry, your throat might tighten, and swallowing can become a little more difficult. These changes are temporary, but they can feel uncomfortable in the moment. This is your body's way of prioritizing other functions deemed more essential for survival in that moment. Blood flow is redirected to your muscles, your senses become sharper, and non-essential processes like digestion and saliva production slow down. Medical professionals see this reaction all the time, and they understand how common it is for patients to feel this way. If you're feeling nervous, remember that healthcare workers are there to support you. Don't hesitate to let them know how you're feeling. They can offer reassurance, answer your questions, and help you feel more comfortable during the process. Sometimes, just talking about your worries can make a big difference. So if you find your mouth feeling a bit parched before or after an HIV test, don't panic. Take a few slow, deep breaths, and remind yourself that this is a temporary reaction. Drinking a little water or focusing on your breathing can help ease the discomfort. It could simply be your body's way of reacting to the stress of the situation. Remember, you're taking an important step for your health, and it's okay to feel a little anxious along the way. With time, support, and self-compassion, the process can become easier, and you'll know you're not alone in how you feel. While anxiety is a common culprit for dry mouth during HIV testing, the test itself could also be a contributing factor. This is especially true for oral swab tests, which involve swabbing the inside of your mouth to collect a sample. The swabbing process can sometimes irritate the delicate tissues in your mouth, leading to temporary dryness. Additionally, some individuals might experience a mild allergic reaction to the materials used in the swab, further contributing to dry mouth. If you're concerned about dry mouth related to the test procedure, discuss your concerns with the healthcare provider administering the test. They can address your questions and offer alternative testing options if available. The good news is that dry mouth is usually temporary and not a cause for serious concern. In most cases, it resolves on its own once the triggering factor, such as anxiety or the test procedure, subsides. However, it's important to address persistent dry mouth, as it can sometimes be a symptom of an underlying medical condition. These could include conditions like diabetes, autoimmune disorders, or side effects from certain medications. If you experience chronic dry mouth, consult your doctor to rule out any underlying health issues. They can help determine the cause and recommend appropriate treatment options. Dealing with a dry mouth can be, well, pretty uncomfortable, but there are simple steps you can take to alleviate the dryness and stay hydrated. First and foremost, drink plenty of water throughout the day. Carry a water bottle with you and sip on it regularly, especially if you're feeling parched. You can also try chewing sugar-free gum or sucking on sugar-free hard candies to stimulate saliva production. Avoid sugary drinks, caffeine, and alcohol, as these can actually worsen dry mouth. If you're a smoker, quitting is honestly one of the best things you can do for your overall health, including your oral health. It's understandable to feel apprehensive about HIV testing, and the possibility of dry mouth might add to your concerns. However, it's crucial not to let these worries prevent you from getting tested. Remember, knowing your HIV status is vital for your health and the health of your partners. Early detection allows for timely treatment and reduces the risk of transmission. And as we've discussed, dry mouth is usually a temporary and manageable side effect. If you're concerned about dry mouth, talk to your healthcare provider. They can offer reassurance, address your concerns, and ensure a comfortable testing experience. HIV testing is not just about individual health. It's a crucial component of public health initiatives aimed at controlling and ultimately ending the HIV epidemic. By getting tested, you're contributing to a larger effort to understand and address HIV transmission rates within communities. Widespread testing helps identify individuals who are unaware of their HIV-positive status. This is crucial because people who don't know they have HIV are more likely to unknowingly transmit the virus to others. By promoting testing and early detection, we can connect individuals to care, reduce new infections, and move closer to a future without HIV. Getting tested for HIV is an act of self-care and responsibility. It's about taking charge of your health and making informed decisions about your well-being. Remember, knowledge is power. Knowing your HIV status empowers you to take appropriate steps to protect yourself and your partners. It allows you to access treatment if needed and live a long and healthy life. Don't let fear or discomfort hold you back. Get tested, know your status, and prioritize your health.